to working with health-related concepts.
Mm-hmm.
So no, they aren't gonna, even though I would help them interpret maybe the findings, the blood work, they still might not be able to act on that without the layer of. So yes, you need that in between. But once you have that, then I think that's going to make a huge change.
Now that given neural networks and AI and deep learning machines, this layer, how far do you think we can go with that? In the sense, I'm not saying that we should replace doctors, but some people in Silicon Valley believe that eventually
Yes.
AI will take over and just guide you through the whole thing.
There's no question that the role of doctors is going to be very different just in 10 to 20 years from now. It's going to be absolutely totally different, because so much of what doctors and nurses are spending their time on now can be much of that can be easily done by AI already now and can be implemented within the next 10 to 20 years. So but I think that's just great because that allows us to spend more time at the bedside and we barely have time to talk to the patient sometimes,
right,
because of all of the data and paperwork. In that, I mean, there's so much. So currently we have decision support, where you can have AI helping the healthcare professional make decisions. We could be using that a lot more than we are, because that AI decision support is always going to be based on the best clinical guidelines and such, and you know that unfortunately that is very far from the case in medicine today, with people, with humans. So decision support is maybe the first step. Then more and more we're going to transition into where AI more and more takes over, and humans are just kind of on the sidelines monitoring and working with edge cases. So that's
I mean, I was just reading that IBM Watson keeps track of all the new publications and almost all new findings that is happening all over the world, and kind of keeps doctors up to date, because as I would think that just to keep up with all the things that's going on is probably a job in itself. Maybe that's where we can use tools and technologies to catch up.
And if you think about, so you come into a hospital with, let's say chest pain or whatever, that AI, if it has properly structured data and access to all that data, it can both pull all of your relevant information from all the different clinics and even your family history and, So all of that data, and they can pull all that external data on clinical guidelines, new research, all of that, and pull that into a decision, within seconds. So that's a really different situation.
I mean, medical knowledge is doubling like every few years now. So it's impossible for a human mind just to, I mean, you used to be able to read all the medical journals and just to keep up, especially in your specialty. But now it's getting impossible. I mean, Watson is actually in the US helping doctors to make really personalized care plans that would just be too complicated for a human mind to even think about. So it's going to change a lot in those things.
I mean, it's very exciting times, and I think the next decade is going to be a lot more fun. And it's also good that I'm getting old, so hopefully, all my ailments will probably have a fix down the road. That being said, I just wanted to bring some context to Startup Iceland. So this year we are bringing a bunch of founders who actually, just like you, Dr. Tryggvi, just asked a different question about some really weird problems. Like, for example, incurable cancer. Can we cure incurable cancer? I mean, up until now, we've just given up on pancreatic cancer. Just said, okay, if you have pancreatic cancer, we pretty much count your days and then, you're dead. But Maria, who's coming, she's found this company called Synthesis Labs, where she used a very different way to get to an answer. She took all the data about a cancer, created a Monte Carlo simulation, and saw what cancer cells did in a computer environment, a virtual world, kind of like a body, And then she saw that they were starting to make communication links, like protein chain links to communicate. She just found a compound that would stop that protein chain from, propagating, and it kind of pushed the cancer cells down. And she actually went further and got to a compound that is probably at the second stage efficacy, which a pharmaceutical company would have got to in maybe 5-6 years and maybe spent $15-20 million. She did it in like 3 months and $20,000. So, I think we are probably not even scratching the surface in terms of asking some really fundamental questions about health and life and all the things that are happening around us. But with technology, we can now. We don't have to go cut open somebody to see what's going on. We can probably grab data, create a simulated environment, and see what's really happening in a virtual world. And that's the context we're bringing to Startup Iceland this year. There's going to be a lot of interesting discussions around that, and you're going to be there, so I'm looking forward to hearing your talk. And I want to open this up to everybody to ask questions. Here's a doctor, here's somebody who's working with the Icelandic healthcare system, and any questions you have, more than willing to have them.
Yeah, I just want to ask Tryggvi, because you were mentioning preemptive medicine or predictive medicine. I was wondering how much genetic medicine is kind of functioning in the technology that you're talking about in terms of scanning data and knowing what's going to happen. Like you spoke about diabetes, and that you could see maybe years or decades ahead that someone was kind of leading up to this condition. Is it possible to use genetic data to do the same?
I think the P4 medicine that I mentioned. That I think so that's based on all of this data and AI and all this. One of the probably maybe even the most important input of data into that is the genomics. And so you have pharmacogenomics, where you can basically develop medicine that target your condition based on your genomics, and so that's one of the most important parts of this revolution is using genetic, because I mean when at the end of the 20th century, it was extremely costly to scan your genome. I mean, hardly possible, but now it costs what, $100 or something?
$99.
Yes, so that's already a non-issue to have all that information. So if you feed that into these models, that's one of the things that's really going to radically change, and that's being used already in personalized care plans and such.
I mean, we in Iceland we have a very unique opportunity, and this is something that Arvind Gupta, who is actually an investor in biotechnology companies, he's coming to Startup Iceland. He told me when I told him that, hey, I'm thinking about health, and we're trying to do personal data, trying to talk about personal data. He said that's the holy grail. If you can get the genome data, and then if you get the phenome data, then you can literally map the entire human experience. And when you are able to map that in the virtual software simulated environment, we can more or less kind of target many different things and go after things that we thought were not possible at all. So as I said, we are kind of embarking on a very interesting time in our lives, and it is exciting, but it's also a little bit scary, because when you really think about it, once you capture all of this data, pretty much everybody would know what's going on with you. And so privacy and security and all that stuff becomes terribly important. And that's why I wanted to chat a little bit about the security side, Ingi. How are you, of course the law is clear that I can get my data, but how do we ensure that others don't get my data pretending to be me?
Well, it's of course a challenge, and no data is completely secure. I mean, if someone can get into the Pentagon, of course they can get into your patient record data if they really want to. But the value is in at least in the past, no one has really seen the value in doing it. So it's maybe that is going to change. But we have actually in Iceland we have a long history of collecting data. I mean, we have databases at the Directorate that go back to the 70s in some cases. So we have like all the patient records from or all the coded data from the patient records in primary healthcare since I think 76 or something. And then of course that is locked somewhere safe, but all the data that is actually being used of course is live, and we need to be able to feed it from one place to another, and I mean the connections between all the healthcare centers and the hospitals, that is a closed network of servers, and it's running on the internet, but it's a closed network of servers. Everything is coded and so and yeah, should be at least very difficult to get any data from there. But if you're actually giving data to the person themselves, that really is the biggest challenge, because once you give them the data, it's actually their responsibility to really handle it.
Yeah.
And as a governmental institution, for example, we can't actually expect the persons to understand what are the risks and all that, and so we really need to be very conservative in security measures and all that, and it's for the patient portal, for example, you need to use the electronic ID or rafræn skilríki, and we are criticized a lot for that. I mean, there is no real harm in if someone gets my data, but that can actually change tomorrow. So if you're even you only have like some small problems in the past, but tomorrow you can have a big problem, and you don't want the insurance companies or anyone to know about it. So it's the new regulations, the EU regulations that are going to be in place next year, actually plays a big role on institutions like ours to explain to people that these are the risks. So we actually, I mean, some people say that we should just give them everything and then it's their problem, but it actually isn't, especially by the new regulations next year. We really need to think about, and of course Big Brother, you could say Big Brother is monitoring or trying to control everything.
So the regulation you're referring to is the EU GDPR, the General Data Protection Regulation.
But since the patient record laws since 2009 has been actually saying the same as the regarding the patient records as the EU regulations are saying, so it's not really a big change, but but we are opening up things that for vendors, if they want to use data, you can actually get an API, so you can actually get the data for that person, but of course the person has to consent and all those things, and we have to really go through measures to make sure that everything is safe and all that. But it's could be opening up a big opportunities or big opportunity with companies to make specialized apps and things. I mean, the patient portal is not going to be doing the things that you're, for example, describing in your app, and we are going to be things like you're going to do e-bookings and do all those things. But if you really want to get some added value, we will not provide that in the government-run national portal.
So we will obviously be working a lot more on that side, and I'm very gung-ho on trying to get the word out that biotechnology is the new software, the new internet, because I think the value of the internet is more or less captured by Google and Facebook, so there's no value to be captured there. The next realm is only the human biology. And of course, human biology is also driven by systems and algorithms and things like that. So there is tremendous opportunity in that space. So if you're a startup founder or you're doing anything in the healthcare space, you should hunker down and don't give up. keep building it, and that's how we go. If there are no more questions, I'd like to end the formal part of the session, and then we can network and chat and do other things. Then we can also stop the recording. Any more questions? Anything else you're thinking about?
You can also take your questions just directly to
Yeah.
Yeah, sure.
Yep. All right. Otherwise, thank you very much. And, looking forward to chatting. Thank you. Thank you.